Well, ahead of those arguments in the International Court of Justice and our application to have them declare Israel's actions as a genocide, let's get a better understanding of the situation in Gaza itself now. Hisham Mhanna is the Media and Communications Officer in Gaza for the International Committee of the Red Cross. Hisham, good afternoon to you. What is the situation like for people in Gaza at the moment? How bad is it?
Good afternoon, and thank you for having me. The situation in Gaza develops only from bad to worse since the 7th of October until the moment. More displacement is witnessed amongst the population from the middle area towards the south governorate of Rafah, which used to be inhabited by approximately 300,000 people before this war started. Now it's inhabited by more than 1.3 million people, completely disconnected from any sewage system, have a daily hardship and hustling on a daily basis to seek nice food, water, education for human consumption, medicine, healthcare, milk powder for their babies and diapers, in addition to hygiene items. They are living in unprecedented humanitarian situation. I think it's an inhumane situation that they are forced into. The hostilities continue to expand. The military operation in southern Gaza Strip continues to also expand, affecting everything and everyone, especially hospitals and medical workers who are supposed to be enjoying a special protection under the international humanitarian law. We have witnessed health workers that have been killed, injured, or detained indefinitely. And adding to that also the limitation of the medical aid supplies and equipment that is required to support those who are rushed into the emergency rooms on a daily basis. The healthcare situation in general is approaching a moment of collapse if hostilities do not stop and if humanitarian aid is not allowed to be flowing safely and in an unimpeded manner.
I mean, is it even possible for people to get food there? I mean, there must be concerns that some people might literally starve to death.
Yeah, famine is looming in the Gaza Strip, especially in northern Gaza Strip, where people do not actually receive humanitarian aid as they are expected to or supposed to. In southern Gaza as well, we can witness people literally searching for food on a daily basis. And for many families, for the vast majority of the population, they are lucky if they can have one meal a day. Everything is also expensive. Even the available food items in the market are extremely expensive. The prices have doubled by 10 times for some items. Let's remind the viewers that the food insecurity level in Gaza Strip before this has reached 80%. Now we're talking about a complete food crisis situation for 2.3 million people.
And children, I can't imagine what it must be like to be a parent or a child in Gaza at the moment. I mean, looking for children must just be impossible.
Of course, thousands of children have been killed. Thousands have already still unaccounted for. There are children who were born during this war without any access to adequate health care, as they are vulnerable in nature. There are also sick children with disabilities who do not have access to proper health care service, as they are entitled to be regularly inspected. There is lack of medication, nutrition, hygiene that contributes to the quality of their life. In addition, the mental health that is leading the mental health issue is an issue for the entire population. But for these children, I think it's going to be a scar forever for their entire lifetime. A whole generation in Gaza grew up in a situation knowing nothing but restrictions of the movement of people and goods. Some children have survived 3, even 4 conflicts in the lifetime, over the span of only 4 or 5 years.
And what kind of care and help are you able to give people? Are you even able to help people at all? Because it's so difficult to get any kind of material into Gaza.
We're doing our best to support the healthcare system in Gaza. We are in constant coordination with the health authorities in the Gaza Strip. We're trying to support hospitals and healthcare workers with the available medical supplies, disposables, medicines, spare parts. We have a surgical team as well, who's stationed at the Gaza European Hospital and Khan Yunis, governorate in southern Gaza Strip. They are working closely hand by hand with medical specialists who are Palestinians. They are operating on a daily basis on patients who are suffering from severe burns. They are doing constructive surgeries for orthopedics. We're providing also physical rehabilitation services, mental health interventions. However, this remains a drop in the ocean, endless ocean of growing needs on an hourly basis, not only daily basis. However, the lack of security guarantees that are required and essential for ensuring that there's a meaningful intervention and humanitarian response provided by the ICRC and other humanitarian workers, in addition to the limitation of the humanitarian aid that is allowed to enter Gaza, adding also another factor of the ongoing hostilities. This should all make the situation go from bad to worse, which is why political solution is now required to put all this bloodshed into an end. And it was proven by practice, as we have witnessed the ceasefire that has lasted for 7 days last year.
Hisham Mhanna, thank you very much indeed. Really do appreciate the time.